Hello, everyone, and welcome to today's webinar, College Students' Perception of Alcohol Drug Prevention Initiatives. My name is Grace Rowan, one of the graduate assistants at IHEC, and I'll be your moderator. I'm assisting Aisha, the Assistant Director for the Illinois Higher Education Center for Alcohol, Other Drug, and Violence Prevention, and we are very excited to be hosting today's event. Before I hand over the microphone, I have a few housekeeping items to cover about today's webinar and the GoToWebinar platform. For those of you new to using GoToWebinar, you will see the control panel on the right of your screen. This is where you'll find the question box that you can type and submit to at the end and during the presentation. There's a portion for questions. You can type it in the chat and I'll read it out loud. All attendees will be muted for today's program, but that does not mean you still can't participate. So without any further ado, I'd like to introduce today's speaker, Dr. Bowers and Dr. Hillier. Welcome.
Hi, everyone, and thank you for being here today. Dr. Nikki Hillier and I are honored to have this opportunity to share some of our research with the IHEC community. We express our sincere gratitude towards Dr. David Erickson and also Ms. Aisha Khan-Crow for the leadership in the IHEC initiative. Nikki and I are faculty in the College of Health and Human Services at EIU, and we have collaborated on several projects that have led us to this presentation on college students' perceptions of alcohol and drug prevention initiatives. Today, we're going to begin with our backgrounds and the literature on alcohol and drug policies and prevention. We do not claim that this is some sort of comprehensive review of the literature. Rather, it's a summary of the literature that's led us to some of our current efforts, some of the things that we're currently doing, and we'll discuss some of those. With respect to the literature review, we focus on a couple of main themes. So one, that is common issues discussed for youth and emerging adults, college students, programming and policies. And then also why we believe participatory approaches might be effective. So anyway, there's three different main areas that we cover in our initial literature review, but each are important in the rationale of some of our current initiatives. So then for the second half of the presentation, we're going to review the preliminary results from a study that we're currently working on together. And we hope to engage you all in discussion on best practices for substance abuse prevention efforts. So I am Jill Bowers, and I received my bachelor's and my master's degrees from Family Services at EIU. Then I went on to earn my PhD in Human Development and Family Studies at the University of Illinois at Urbana-Champaign. And throughout my time at the U of I worked with the U of I Extension and their family life programs. I've worked on a variety of program development and evaluation efforts, such as child abuse prevention, divorce education, work and family balance, and other areas of family life education. Following my time at the University of Illinois, I worked on a variety of grant-funded projects that involve program development or evaluation. And each of these research and program development evaluation efforts influenced my interest in programming for college students. And one of those subject areas includes alcohol education. So currently, I am a faculty member in Human Services and Community Leadership at EIU, and I've had the opportunity to work with Dr. Hillier, who's in Public Health, and also in the College of Health and Human Services at EIU.
So a little bit about my background. I studied at the University of Illinois for many years, where I got my PhD in community health. I spent over a decade at the local health department as a program coordinator, working under a variety of grants, and one of them was the Tobacco-Free Communities grant, where I worked on a lot of state and local smoke-free policies. My dissertation research with the local health district was on tobacco sales to minors. I also did TIPS training with the community, a program that helps servers serve alcohol responsibly. And now I'm an assistant professor at Eastern Illinois University in the Department of Public Health in the College of Health and Human Services. So now we'd like to do a poll just to see who's here. So
Just
Grace
to
was
give you some idea of
okay.
where you're at, the areas of research that you work in, or if you're staff at a university. So we just kind of want to know who's with us.
Everyone is getting their votes in now. We're looking about 60% have voted, and we'll give them about one more minute to see what the results are. Okay, so we're looking at 52% of us on here are health education, 24% student affairs, 4% nursing, 4% administration, and 16% AOD prevention.
Great.
Okay, that's great. And we're going to go ahead and turn off our cameras and then do the rest of it through audio only. But to me, that's very exciting because there's a wide variety, and I'm hoping that between all of our different areas of expertise and our backgrounds, then we can have some meaningful discussion about, prevention in this area. So with Nikki's background in public health and my own background in program development, we actually started talking about some of these issues a few years ago. So with my training in human development, I believe that it's important to note that exploration and experimentation with sex, relationships, drugs, and alcohol, it's really been found to be a normative part of emerging adulthood. And adapting some of the work of, developmental theorist Dr. Jeffrey Arnett, and some others, we view emerging adulthood as 18 to 25-year-olds for this presentation. So we're focusing on 18 to 25-year-olds who are in college. Many will not become addicted or engage in problem drinking behaviors. However, this topic is critical because there are long-term health consequences, as many of you know, associated with problem drinking, and really some of the risk-taking behaviors associated with it, including impaired driving, sexual promiscuity, or unsafe sex. We also know that there are a few comprehensive resources for alcohol and drug prevention that have been formally evaluated. So there's very few comprehensive resources that have been formally evaluated and found to be effective with behavioral changes. Further, similar to other topic areas such as sexuality education, we know that abstinence-only approaches to prevention often do not work. And in order for the programs or initiatives to be effective, they need to be learning centered. But what actually does that mean when we're working with, emerging adults and specifically in the area of problem drinking or substance abuse prevention? So how do we best approach policies and prevention in this area? And how do we know this without working with emerging adults or college students? So we're constantly trying to help and teach them, but what can we also learn from them? So that's really the purpose of this research. Some of the common issues in the literature on college students' health risk include alcohol, e-cigarettes, vaping, marijuana legalization, and also the opioid epidemic. There are others, but we're going to begin by highlighting some of these issues, policies, and programs associated with these four main issues. So while we know there's no such thing as traditional college students, quote unquote traditional college students, we're going to focus on issues that are most common for college students who are 18 to 25 years old. And we're going to use the term emerging adults. Again, that's a developmental term coined and utilized by Dr. Jeffrey Arnett. And really, he expanded that to include 18 to 29-year-olds. But we're focusing on 18 to 25-year-olds. We're going to use the terms emerging adults and also college students interchangeably.
So in this part, we sort of shovel a lot of information in here, but we thought it was important to cover numbers, issues, and some programming before we delve into what we're working on. While drinking has been steadily declining among college students, especially in states with legalized marijuana, it is still the most popular substance among college students. And their rates of use are higher than their non-college counterparts. These numbers are from the Monitoring the Future report sponsored by the National Institute of Drug Abuse. That 75% of college students drink, or that 60% have in the last month, may not be a major concern, but binge drinking, 4 or 5 more drinks in one sitting, and extreme binge drinking, 10 or more drinks, a measure that Monitoring the Future started assessing back in 2005, are major concerns, behaviors that can lead to dependency and overdose. And then there are other considerations like the severe consequences of drinking, car crashes and assaults that Jill mentioned, and more common but less severe poor grades, missed assignments, and leaving school. But we can see that there are students who can drink responsibly and those who can't, and it's important to look at the reasons students engage in drinking. Jill?
So with respect to problem drinking, I worked on a longitudinal study a few years ago with Dr. Chris Seegren from the University of Arizona, and we examined risk-taking behaviors among college students, and we were particularly interested in the links between risk-taking in the area of alcohol and sex, as well as the role that drinking motivations and other psychological aspects play in risk-taking behaviors. With a sample of 402 students from Illinois and Arizona, and again, we targeted students who are under 21 when we began the study. We learned a number of things about risk-taking in emerging adulthood, but perhaps a few of the things that I took from this work and began thinking more about how we could utilize some of this information in prevention programming. Those included, well, first, it's not just that, you know, drinking in general is bad, or that drinking itself led to sexual risk-taking or negative consequences. Rather, it's why they drank. So, for example, drinking to fit in with peers, drinking because they were seeking sex or coping with emotional pain. It was all of those things that were actually significantly associated with the risk-taking behaviors, not just drinking itself. Not surprisingly, we also found links between problem drinking and psychological distress. Further, we created 2 different measures throughout the study duration. One of them was a measure of transitional instability, again, based on the work of Jeffrey Arnett and other developmental theorists who focus on transitions and areas of identity development that many emerging adults are concerned with. So for many, these involve transitions surrounding relationships, right? Residence, education, employment, children, finance, health, you know, really just balance in their life between health and relaxation, and all of these other things. So there can be a lot of uncertainty and changes associated with each of these areas during emerging adulthood, and some may experience more transitional instability than others. So in addition to the transitional instability measure, we also created a measure for self-doubt and asked students to tell us whether or not they experienced self-doubt in the last month. So for example, did they question their own ability to be successful, have successful relationships, or their ability to make decisions? So in short, you know, transitional instability by its very nature creates uncertainty, right? And all of these things were in some ways related, and we found that all of these things, you know, quote, matter with respect to college students' problem drinking and their sexual risk taking. Further, as you can imagine, problem drinking could have a bidirectional effect on many of these things. So like it can also impact someone's psychological distress, their instability and self-doubt. So I believe that a lot of these things are really important to consider in programming. So I just wanted to make sure that we included some of that. In addition to that, one of the other major issues that we've heard about a lot in the last decade, really, but some of it beginning and increasing around 2013, vaping and e-cigarettes has, it's just been a hot topic in the last decade. It increases in middle schools and high schools and on college campuses. Some research has shown that vape shops increased threefold within a few years, and I thought that this was interesting that when looking at college campuses, 70% had a vape shop within a 3-mile radius. So we really knew little about short or long-term effects of vaping or e-cigarettes when they first hit the market. However, now we've started to learn a lot about some of the health risks. Only in the last year have we started to see a decline in e-cigarette purchases, and some of this is, because of the rapid health response due to all of the hospitalizations and deaths, and in particular of youth who were utilizing e-cigarettes. So we don't know for sure if the trend will continue and e-cigarettes will continue to decline. But, I just wanted to mention, some of this. Also, this presentation is really focused on college students, but I want to include a couple of things about high school students. So based on, and this is really the reason why I wanted to include this is because we're going to come back to some of this and some of our recommendations and information later. But I just kind of wanted to highlight here, just looking at these numbers, the growing trend among high school students with e-cigarette use. So 70% is a pretty sharp increase in a 1-year period. The other thing that I want to highlight with high school students is how and where they are getting the e-cigarettes, because I do believe that some of this can provide a lot of insight into programming. So while from a developmental perspective, we already know that adolescents and many emerging adults might not be concerned about health risks, right? If it doesn't impact them right now, or maybe they think that it won't happen to them, right? But so this is also an age group where many start to care more about what their friends do and what they think, more so than what they care about their families or say adults think. And so we will come back to ways that we can utilize this peer-to-peer influence in programming later. I just kind of wanted to highlight this now while I'm talking about e-cigarettes and also before Nikki moved on to the topic of marijuana.
We have seen an increase in marijuana use by college students. 42.6% of college students have used marijuana in the last year, and this is up 7% from 5 years ago. Again, this is from Monitoring the Future. 5.9% use it regularly, and we suspect that this is because of changing attitudes about the risks of marijuana and the legality of marijuana. While there's evidence of marijuana dependency or marijuana use disorder in frequent and early users, most people don't get addicted. Heavy use can be harmful to cognitive functioning, and its use is associated with poor performance in school and dropping out. And then we're also concerned about the means of consumption. Smoking can be a harmful means of consumption. Vaping marijuana has been tied to serious lung injury, as Jill mentioned, and edibles present new concerns that I want to talk about in a minute. But while there's concern of the use of cannabis, especially in younger people, there is evidence that it's helpful in coping with chronic pain, nausea, where it is prescribed. It's commonly prescribed for post-traumatic stress disorder, but it can also be prescribed for a variety of health issues like migraines, Crohn's, and chronic pain. We do see the increased use, and again, we think the increased use is likely due to more positive attitudes towards marijuana and legalization, which likely influence each other, right? Though it's illegal, so people have more positive attitudes about it. People have more positive attitudes about it, so they advocate for laws to change. But with legalization, edibles are more available, and there's unique concerns with edibles because of the difficulty of detection. So people might not know that something has cannabis in it, the slow rate of absorption. So they may be waiting to feel something and ingest more while they're waiting to feel the effects, and that can lead to overconsumption. So we see this as a real opportunity to educate students on some of the special concerns of the legal use of cannabis. In terms of changing policies at schools, from what we can tell, changes in the legalization of marijuana recreationally or medicinally haven't seemed to change university policies, as they need to comply with the Drug-Free Schools and Communities Act, which has been confusing for students and faculty and staff. The other thing that I wanted to talk about briefly is opioids, not because it's a major risk for abuse, but because less than 3% of college students use opioids that aren't prescribed to them. But I just want to highlight some programming that we've done around it that's kind of interesting. The number of college students that use opioids that aren't prescribed to them continues to decline. But as the opiate epidemic goes on, we do think it's important to address, as it might be something that they run into later in life. And then one concern and something to watch for is athletes in opioid abuse. There's a few older studies that point to the danger of opioid abuse and lifetime addiction because athletes were prescribed painkillers post-surgery or to deal with an injury. So it might be a special population for targeted programming. But I just want to talk about the benefits of something that we observed in our students anecdotally. We had the opportunity to bring Narcan training to our students. This is an overdose prevention training. If you don't know, Narcan is a medication that can reverse an opioid overdose. So if someone's overdosing on opioids, heroin or fentanyl, hydrocodone, Narcan can save their life. We partnered with the local health department in Coles County and the Champaign-Urbana Public Health District, and we had a trainer come in and teach our students about opioid overdose prevention, understanding opioid addiction, signs of overdose, what to do, and how to administer Narcan. And this picture is me actually administering Narcan to our trainer. When the students left, they left with all the students that went through the training got a Narcan kit, so they have what they need to save a life. But also one of our faculty decided to learn more and actually become a trainer. So she can offer the training to anyone on campus that's interested sort of on demand. And everyone that goes through that training does get the Narcan kit. We offer that Narcan overdose response training to our students, and we found that training them in overdose response can help them in future. So when they put that on their resume, students have commented that during interviews that different agencies have been impressed that they have that skill. So I think this can help them later in life, but also in their career. So it's good that we can train them while we have them. And Jill's going to highlight some more programming efforts.
Yeah, so I know a lot of you work actually in the prevention area, so you probably are familiar with a lot of the initiative. We're just gonna, briefly cover this. But programs designed to prevent drug and alcohol related issues among college students, they do in fact exist. To date, however, like a lot of the online prevention programs that have been proven effective at addressing behavior changes and over time are scarce. So for example, alcohol EDU is probably the most widely used on college campuses. And the last time I looked, I think I saw that maybe 40% of college freshmen across the United States have been required to take that course. That number could be much higher now, but the point is, behavior change and short-term interventions are hard to detect. They're hard to detect anyway in any type of short-term intervention. And also, many of these programs, such as alcohol EDU, which I mentioned, they include a lot of a variety of really important topics, relevant topics. So we do know that these efforts are needed on college campuses, yet it's possible that existing programs are not necessarily addressing behavior changes as intended because of the ways in which maybe some of the material is presented. That could be one option. So in other words, like the existing alcohol education prevention efforts that aren't changing behavior may not be really engaging participants, although the effectiveness of program characteristics such as the content or the delivery, they really haven't been a focus of program evaluation. So for example, in some exploratory studies that I've done a few years ago and explaining, this content and instruction. I actually interviewed college students. Our focus was specifically on online programs. And so I asked them about program characteristics that they preferred with alcohol education and a few other areas. So again, my focus was on online programs for that study, but one common theme was the content and the topics covered in the programs, such as those focused on alcohol prevention, was that students couldn't relate to the topics. They also thought the programs, and these are their words, not mine, were cheesy or after school specialish. With respect to the instruction or delivery, students said that they favored video testimonials, and they liked programs that had a variety of instructional strategies, including blogs, articles, videos of professionals or students. And further, with respect to who they learned from, which I thought that this was pretty interesting, is that it varied by the topic. So for example, with professional development or career development, they actually wanted to learn from professors or professionals in the field. With topics related to relationships or drug and alcohol, however, they wanted to learn from people their own age or people their own age who were more, they considered people their own age who were more trusted sources in these areas. I think one person in particular said, people like you or my mom, like they don't deal with the same things that we deal with, so I would trust somebody more my own age. I wasn't offended by that. I moved on. But anyway, so I believe that all of these things, like these really speak to the role of peers in being involved in prevention programming and perhaps also policies.
It's challenging to tout the effectiveness of anti-smoking policies on student smoking behavior because behavior influences policy. So as fewer people smoke, it's easier to pass smoke-free policies. And then policy influences behavior. If there are fewer places that are available to smoke, fewer people smoke. But longitudinal studies suggest that policies reduce smoking and pro-smoking attitudes. But we don't know the effects of policies on campus related to alcohol or drugs. Some of the smoking policies already cover vaping or other smokable products, but one thing that we're hearing a lot of is the campus guidelines might be stricter than state regulations as states continue to legalize marijuana and campuses have to continue to ban marijuana because of the Drug-Free Schools and Community Act. So that's one of the things that we asked our sample about is sort of some issues related to housing and marijuana, sort of secondhand exposure to marijuana and access to marijuana in terms of dispensaries. Just going to talk a little bit about why we thought it was important to use students to inform our research projects.
Yeah, so again, I know we're covering a lot in the intro and some of these main areas, whether it be, the focus on marijuana or opioids and, some of the more topic areas. But another main component of our research and philosophy is participatory approaches. So if we want to know how to best help college students, I guess our philosophy is like, why not bring them to the table and informing us and helping us make some of these decisions. So research which highlights the benefits of participatory models has indicated that design elements may be more appealing and engaging to a target audience if the members of that target population are involved in the program development process. So the same is likely true of policy development. Participatory research models involve research, education, and action with the engagement of participants in program development and evaluation processes. So the basic assumption of participatory approaches is that programs would be more effective if members of the target population who the program is trying to reach with that curriculum would be involved in addressing their own needs, and they would be empowered to make changes in their own lives as a result. Applying this to policy development, and again, in addition to programs, we aim to begin to really involve college students in discussions surrounding the most effective policies and programs for prevention of problem drug or alcohol use. So this is what Nikki and I have, been working on. I know a lot of you have already started, doing this, or some of you have been doing this for years. So basically the primary aim of our research is to work with students from a variety of disciplines to explore their perceptions of best practices for policies and programming surrounding drug and alcohol use or abuse on college campuses. And some of this is based on some of my own, exploratory work in the past. And this is just to give you a few concrete examples. So one program that I worked on to develop with students was called Career Skillet. Both of these, Career Skillet and Bench Thinking, are not online right now. By the way, like we're working on, various aspects of the curriculum. But so this has been several years ago. So I worked with students to come up with Career Skillet. They came up with the name, they came up with the logo. And it was focused on helping young adults with professional development. And the other one was bench thinking, and that was focused on prevention of substance abuse, misuse, and also violence. So on both of these projects, we followed this very similar model. I worked with students, other faculty also worked with students to, develop the website, to write research-based blog articles. Students came up with a lot of the topics. They found similar, they found some of the videos online through TED Talks or, YouTube. They also created their own videos. They provided resources and strategies for individuals who were experiencing, certain issues. So then following this, I evaluated students' perceptions of the benefits of working on some of these programs. And again, this is all just exploratory, but they all said that they felt that by working on the program, that they were more invested in the content as well as the program itself. They learned more about the topics, and this is actually true in other areas of research. So for example, with character education, research shows that those that teach it are more likely to internalize that content. Students also reported that they gained mentors, so they had worked really closely with faculty to, write the articles, and then they also learned from other students. So I know, again, this is a lot of information about, some of the background to our work and how we got started in this in our current project and where we're going to go. But we want to pause here. And I ask you, would just like to take a minute and ask you to discuss, what's going on your campuses. So
So
what
you
are
can
some
look back on like some of the things, some of the programs that Jill discussed, if you're doing any kind of peer mentoring, anything like that. You can just type in the chat. Anybody want to share? Yeah, maybe go back to that slide where you list a handful of programs, Buzzkill.
maybe we just have a quiet group today, Nikki.
That's all right.
Or maybe they'll have something to say at the end too, and that's perfectly fine.
We're just shoveling a lot in, and so we wanted to just take a break to see if you guys wanted to share anything. So
yeah, so we'll go ahead and just keep going. And then again, if you have information that, because I think that we can all learn from each other. Like Nikki and I are not claiming to, be experts. We don't know, the details about every single program, but, we have different, again, she comes from a public health background. I come from a program development evaluation, also a human development background. So we're just sharing with you like some of our ideas and some of the things that we have been working on for several years in different ways, and now we're lucky enough to partner together. So anyway, I had mentioned that some of our previous work and the models that we have used to inform the development of this research, we've talked about some of those. Another one is actually by the work of Dr. Robert Hughes at the University of Illinois, and his original framework for developing family life education programs. This really informed our focus for program characteristics for this study. I worked with Bob and a few other colleagues a few years ago to adapt this framework to include a focus on online programming. However, utilizing this framework, we wanted to assess college students' perceptions of the content and the delivery of alcohol and substance misuse prevention programming.
I'm gonna talk a little bit about the work that we've done. We are still collecting data, but we wanted to share where we are with our current study and talk about where we want to go. These were our research questions. We wanted to know what emerging adults think about these prevention programs that are offered, what content should be covered, and how that content should be delivered. We also wanted to ask some questions around policies that might promote abuse or limit abuse or affect their living environment. We don't have enough here yet, but we did ask about their use of a variety of different substances. So we'd like to look at that and see if that influences their perceptions of policies or different programs. So I really want to note here again that this is just preliminary, that we are still collecting data. We recruited from our classes and asked them to recruit from their people who they know too. And our field is heavily skewed towards women. So as you'll see in the next slide, our sample is almost all female. But we do want to share where we are right now. So we got approval from the IRB to conduct this research, and we used Qualtrics to collect the data. Students had to consent in Qualtrics before they could move on to take the survey. We incentivized participation by offering the opportunity to win one of 5 $20 Amazon gift cards. And again, we're still collecting data. Go ahead and so we, again, used a convenient sample. Females are definitely overrepresented. We emailed this out to our classes and asked them to share with people who they know, and there are a lot of women in our field, so that accounts for that. So we're going to work diligently to recruit a more representative sample, but we wanted to share with you where we are and what we're working with. So we first had 77 people respond, and we looked at that, and the age range was 25 to 53, or I'm sorry, 19 to 53, and the mean age was 25. So we realized we had a lot of grad students in there. So from that 77, we pulled out everybody who was under 25, and that gave us a mean of around 21 years old, and left us with about 54 participants. Mostly female, 48 female, 5 male, 1 non-binary. Most of the students were juniors and seniors. We had 60% white, 24% African American, and we have a nice split between urban and rural. So we're excited that we might be able to really look at that representation of rural and urban communities, and it'll give us the opportunity to kind of explore some of those differences. So first we thought we should ask, do they even think this educational requirement is necessary? And they do. About 87% of them, granted women in health and prevention fields, but still they thought that it should be required of college students, new college students. But even though they thought it was required, only about 2/3 thought that requiring it would be effective in preventing problem drinking or drug use. So the good news is, what are we doing right? 68% thought that the content was relevant to them. 56% said the content covered substances that they were later exposed to. So we did a good job of preparing them. 71% thought that the content was interesting, and 26% said that it made them not want to drink or do drugs. So it did its job. And 77% thought that there was a variety of content, which we'll see is something that they're interested in. And there's even more good news. We have some things that we can work on. 67% said that the content covered substances that they'd already been exposed to. So this might mean that we need to start a little bit earlier, or it's just content that they've gotten in high school and they're getting again, and it might be substances like alcohol and things that they've already seen before. But 27% thought that the content was not interesting, and 57% disagreed or strongly disagreed that it made them not want to drink or do drugs, so it wasn't effective at what we wanted it to do. So we asked them for their ideas. What should this education look like? What would be effective means of delivering this information to students? And you might be able to see the numbers here. I know they're kind of hard to see. The font's kind of small, but 54% said that blog post would be an effective method. 64% thought serious articles. 76% said professionally designed videos, 81% were interested in infographics, 77% animations, 87% agreed that entertaining articles would be an effective method. So what they really want is a variety of methods. So we're like looking like they agree, they like all of these things. These are all great ideas. But sadly, they don't want to hear from us. So all of these things, they said, yeah, do this. And then they said only 54% said that they thought they would want to hear research from their professors. But they do want to hear from their peers, and they want to hear from knowledgeable and entertaining experts in short spurts. So 83% wanted to hear testimonials from people who are addicts. 91% wanted to hear testimonials from college students. 75% wanted to hear from experts in the field, prevention specialists, counselors, and 93% thought that TED Talks or YouTube videos would be effective. And they thought that it should be available both online and face-to-face. So we also wanted to know what content they wanted us to include. So not just how do you want this information, what information do you think is important to cover? So we gave them a list of topics and asked them in this space, we only have so much time, what must be covered, what should we try to cover if we have time, and what don't we need to cover? So on the left side of the screen are the things that 75% or more of the samples said that we must include. And on the other side of the screen are topics that less than 75% agreed must be covered. So the most important things are things that we are covering: sexual assault, mixing substances, impaired driving, and then and healthier ways to cope with stress. Less important things were the strategies to prevent binge drinking, like drinking between parties, pre-gaming, and after hours. So this is about their behaviors and their friends' behaviors. So we aren't done looking at this yet, but we gave them a list of substances and asked them what they use regularly, what they have tried at least once, and then what they know their friends are using regularly. We found that a third are drinking alcohol regularly, about 17% are using cannabis regularly, and this is higher than other college populations, but again, this is preliminary, so there's only 9 students that said that, but because the sample's small, it does seem like a pretty big percent, so we're gonna be looking at that. And then 5.6% vape cannabis regularly. Interestingly, none of them smoke combustible or traditional cigarettes, but nearly 10% vape nicotine. And again, that 17% might also be due to legalization. We're not sure. We just have to look at that as we continue to recruit more participants. Then we wanted to ask them about different policies. So we asked them about some alcohol policies. So we asked them about lowering the bar entry age, and they, for the most part, did not think that would be a good policy. And so far, we really haven't seen an association between like younger students versus older students in terms of this policy. Only 25% thought that it might make drinking safer. And only 20% thought that closing bars earlier would prevent binge drinking. So we're not sure what they think might prevent binge drinking. 35% thought that Friday morning classes would decrease Thursday night binge drinking. So that whole concept of Thursday's the new Friday kind of thing. But it doesn't seem like they think that policy would be effective at promoting safe drinking for the most part. And then for marijuana policies, since recreational use of marijuana is permitted for people over 21 in Illinois, we wanted to know what they thought about some policy issues around it. So if you are someone who doesn't smoke marijuana and there's somebody in your environment that's smoking around it, what kinds of responses might people have? So we were curious about how people felt about people's secondhand smoke exposure, secondhand exposure to marijuana smoke, and then about limiting access in terms of where dispensaries were. So we asked them to agree or disagree with different statements, like since marijuana is illegal for people over 21, should people over 21 should be able to smoke in a bedroom of a shared apartment. And 61% agreed with that. And then we asked them to agree or disagree with the statement smoking marijuana should be allowed anywhere in public or private, and 42% agreed with that. And then we asked about access. So should anyone be able to open a dispensary anywhere? So kind of thinking about zoning issues or access near schools, and 54% agreed with that. So we were just kind of curious about their opinions on different policies, since these might be things that are coming up. So this is really where we are with the small first responses to our study. And all of this is based on policy and programming, asking students about those things. And while it's preliminary, we do have some recommendations from our early findings for program developers and researchers.
Yeah, so based on our literature review and some of the preliminary data that Nikki shared, we do believe that there's value in involving college students in the process of program development. With respect to the content, we hope to continue to collect more data about what students want and what might be best in helping to prevent drug and alcohol misuse or abuse. We do believe that it would be useful to include, healthy ways to cope, such as perhaps helping them cope with transitional instabilities or psychological distress without turning to drugs or alcohol to cope. So we do think that that's one area that we might want to cover. Certain topics, as Nikki mentioned, improve their knowledge on the types of drugs, such as the edibles, and and again, the types of drugs could vary by geographic location. With respect to delivery, we want to really think about how we can utilize peer influence. So for example, college students could work to create programs for other college students under, the advisement of faculty or staff. We want to know, like, would it be useful for college students to teach high school students? And, they can learn themselves based on what we know about previous literature. They can learn themselves by creating the content. And then when, they can also reach students at a younger age, and those students at that younger ages may be more likely to listen to, these college students or these 18 to 25-year-olds than they would for some of us, that are, professors or, researchers or, in their minds, really, really old and ancient. So anyway, just specifically, one of our projects that we are looking at, and this is how Nikki and I kind of started talking about this. We wanted to do research to inform it first, but we are looking at actually this summer just kind of piloting some projects with working with college students, mainly undergraduates, college students, to create modules and content for high school students and youth in our area. So we're using some of this research to inform, and then we also want to continue to work with college students. And one of our first steps is going to be to have the college students to create these modules, but really with the high school students in mind. And then, we can kind of go from there. So targeting high school students with some of these modules with the topic areas that we've talked about. With delivery, also, like some of the recommendations, students really appear to prefer videos of students, videos of professionals in the addictions field, video testimonials of individuals who have been addicted to a substance, and also the social media. The use of social media might help. So that's come up. We may look at things like memes or TikToks as, silly or not educational, or how can we utilize that in education? But a lot of this research is showing that, a variety of content matters. So, and while it's our job to, educate them and not entertain them, we really can't educate them unless we're engaging them. So getting on their level with some of these things is really, really important. With respect to recommendations for research, It's, pretty, this is probably what you're going to see in any type of alcohol education, or most research really. So more longitudinal data. We need more longitudinal data that examines, the long-term impact and the effectiveness of, and specifically in the area of behavioral changes associated as a result of prevention programs and policies. So how are we doing this? And so in order to look at this, we need to look at the data over time. Also, we want a closer examination of how, needs may be vary based on geographical location or other demographics. I thought it was interesting, like we didn't really talk about this, but we had a wide variety. So we are at Eastern Illinois University, and it's in Central Illinois. And with some of the drugs that they talked about either using or that their friends use on a regular basis, again, it was a wide variety. So some people would put things like meth and bath salts. Others, talked about heroin. Others, were focused on cocaine or marijuana. So, it just was a wide variety, and we just wondered how that is going to be different and, based on the geographical locations that we're trying to reach with some of our programs. And, there's other areas of demographics that we could explore a little more. We also think that there's a need for more research utilizing participatory approaches and looking at how effective this would be to, get college students involved in this program development, even more program development efforts, and specifically for those with high school efforts for high school students. So, in conclusion, as adults, we know that we all have knowledge that students can benefit from, knowledge about health risks and choices, and at the same time, we can't really reach students with this information if they're not engaged with the programs we create, or if they don't believe in the policies that, we enforce. So by learning more from college students and investing them in program development efforts, we believe that we can improve our programs for prevention of substance misuse and then also abuse. Also, policies we'll need to continue to assess these based on the changing needs of students, contemporary issues, and then also legislation. Students can continue to help us to create policies that need to and can be enforced on college campuses as possible. So this is, this really concludes our presentation. And, I know that we had an hour for this, but in our last 9 minutes, we really would welcome any sort of discussion related to this topic. We'd love to hear anything that you all are doing. And Nikki, I don't know about you, but I'm going to go ahead and turn my camera back on. So you can type in chat, so the chat box, any questions that you might have. And again, we just want to hear what you all are doing. I know there's a lot of people have different efforts across the United States on college campuses. They don't want to talk to us, Nikki.
And that's okay. It's a rough time for people right now, and
yeah,
people have a lot going on. So we definitely appreciate your time. And
I'm hoping, or I'm going to ask Aisha if she can also post our contact information on the website. I know that she's going to post this. So with that, if you all have any suggestions or ideas based on some of your own experiences, we welcome that. These are just some of ours and some of our current initiatives. So we can wait just a few more minutes.
Definitely a quiet group. But we will, by the time of the end of this week, we will have your contact information up as well as the recording to this presentation. So people might want to rewatch and then might have questions once they absorb it.
Perfect. Yeah, and feel free to reach out to us anytime. We kind of look at this we're all in this together as far as figuring out different things that will work. What might work on our campus might not work on someone else's campus, but I do want to I would love to hear from you on what you're doing and how we can improve. Nikki, do you have anything else to say in conclusion?
Yep, we appreciate your time, and like Jill said, like we're happy to hear what you guys are doing, see how we can work together, or anything that we can offer to support you in your programming, we're happy to do.
Absolutely.
Okay,
Okay,
well,
great.
thank you,
Thanks,
Dr.
everyone.
Jill Bowers and Dr. Nikki Hillier, and thank you everyone for attending today's webinar. And just one quick note, so please keep an eye out for an email for GoToWebinar that will come about an hour or so after the program. And the email will have a link for you to fill out an evaluation. This evaluation will really help us with the planning of future events. And then lastly, certificates will be issued within 7 to 10 business days from the webinar. But to conclude, thank you everyone. Thank you presenters.
Thank you.
Thank you. It's been
Okay.
great.